Warm welcome. This is Spectrum on Radio 1. I'm your host, Edmond Kizito. On Spectrum tonight, what are the dangers of tobacco use and measures that can be taken to deal with the situation? Tobacco use is a significant risk factor for several diseases and a major contributor to the global mortality, with the World Health Organization estimating that it's among the top drivers of the current global disease burden. Reports indicate that up to 13,000 people die each day from tobacco-related illnesses, leading to a global death toll of 6 million people annually. It is estimated that by 2020, this death toll will have risen to about 8 million, accounting for some 10% of deaths annually. In Uganda, cigarette smoking is seen as a sign of prestige and closely associated with wealth and esteem, despite its well-known dangers. In most cases, people smoke openly, even in places not designated for smoking. Experts say that non-smokers are at high risk of acquiring tobacco-related diseases through inhaling another person's smoke, and many have argued that efforts should be taken to protect the innocent, especially children, well, including children, because they too smoke passively sometimes. It is estimated that some 600,000 people perish annually from diseases caused by passive smoking, with the majority of these being women and children. Tobacco growing and processing is a key contributor to the GDP of many countries, including Uganda, and many governments are hesitant to take measures that would affect their economic gains. The Center for Tobacco Control in Africa is leading a continental campaign aimed at reducing the consumption of tobacco through helping governments to implement evidence-based control measures. So tonight we try to understand the challenges related to tobacco use, and if at all, there are measures that can be taken to deal with these challenges. Our guests tonight, Dr. Prossy Mugyenyi, manager at the Center for Tobacco Control in Africa. She's online. You most welcome Dr. Mugyenyi.
Thank you, Spectrum, and I greet all the listeners. I'm sorry I am trying to reach the studio, but I'm able to contribute here. I'm in the jam, but I greet all the listeners.
All right, let me ask you to introduce yourself, your name and your full name and what you do. Hello? Do we still have you on the line? Hello? All right, listeners, we expect three guests tonight. Dr. Prossy Mugyenyi, manager at the Center for Tobacco Control in Africa. Dr. Robert Machangu from the World Health Organization office in Kampala. And Mr. Richard Baguma from the Uganda Health Communications Alliance. We expect them to join us in the studio. Right now we have one of them on the line. Hello, you're welcome to Spectrum. Hello? Okay, that line will be rectified in a very, very short while. Hello? Hello? Okay. Well, someone... So, that's why I'm going to be an issue. Spectrum, hello? Okay. Well, I read on some of the statistics that are pertinent to this. Yes, Spectrum, hello? Dr. Prossy Mugyenyi, is that you on the line?
I can't get you very well. I don't know, my connection is not so good.
We can hear you loud and clear. Can you hear us now?
Yes, somehow, but I don't speak all the words.
Alright, can I ask you to introduce yourself, your full names, and your organization and what you do for them?
Yes, thank you very much. Spectrum, as you have said, I'm called Dr. Prossy Mugyenyi. I am currently the manager of the Center for Tobacco Control in Africa, abbreviated as CTCA. And this is an initiative of the World Health Organization to spearhead tobacco control in the African continent. And this center is housed and supervised by Machangu University, College of Health Sciences, School of Public Health. It's located in Kasangati, the former Kasangati Health Center 4. And the center is essentially a center created to support the government, initially in the 5 countries of Uganda, Kenya, South Africa, Angola, and Mauritania. And this is for the first years, then later the center will be able to support the other countries in the African region. So briefly, that's what I can say for now.
All right, Dr. Mugyenyi, can you tell us what drives people to smoke? We all know the dangers. Why do people smoke, nonetheless?
Well, I think my personal feeling is that people smoke for various reasons. Sometimes people smoke because they are influenced by their friends. Most people start smoking in the early stages of their life, in teenage life. So sometimes people smoke because they have been influenced by their colleagues. Some of them take the habit in their homes when they are still young. Others take it in schools. Others take it in social groups, in bars, and so on. Others, smoke just because they find their parents smoking. Some of them find their colleagues smoking, and some people smoke because they think it is prestige.
And some people think it's a prestigious thing. Is that really true? Do people, when they see you smoking, do they say, this is a man or woman who's well off, he has a good life?
Yeah, some people, but then some people smoke because they think it is truth. It is, it's nice. Some people think it is nice to smoke, and by the time they discover that it is dangerous, they have already started the habit, and they find it difficult to stop. But smoking is very, very dangerous.
Is it an addictive thing?
It is very addictive. Smoke, the tobacco which is used in smoking, it contains a chemical called the nicotine. This nicotine is very addictive. When you have started, most people find it difficult to stop. You feel you can't do without it. It's like these other addictive substances, alcohol and these other drugs. So the smoking has that, the smoke has that component, that nicotine, which makes people continue wanting to smoke again and again and again, and they are like prisoners. They are like prisoners to the habit of smoking.
All right, listeners, this is Spectrum on Radio 1 tonight. What are the dangers of tobacco use and measures that can be taken to deal with the situation? Our guests tonight, Dr. Prossy Mugyenyi, manager at the Center for Tobacco Control in Africa. We've just been hearing from him. In the studio with me right now, I've just been joined by Dr. Robert Machangu from the World Health Organization in Kampala. You're most welcome, Dr. Machangu.
Thank you.
We're also joined by Mr. Richard Baguma from the Uganda Health Communications Alliance. You're most welcome, Richard Baguma.
Thank you very much, and it's nice to be here again.
Mr. Machangu, can you tell us a little bit about what you do at the World Health Organization?
Well, right now in Kampala, my major preoccupation is that I am a senior project advisor to the Center for Tobacco Control in Africa, which is a recent institution being established through the assistance of WHO here in Kampala in collaboration with the Makerere University School of Public Health. So my job is to work with the center to assist it in its founding and prepare the programs of capacity building, advocacy against tobacco use, and of course policy advocacy. Those are the major areas of my activity here in Kampala.
Advocacy about tobacco use, what exactly do you mean? You want the device to be banned or what?
Well, we educate people, if I may put it that way, on the hazards of tobacco use. Because many people do not understand that tobacco is a killer substance. That is our activity number one. After that, we want to enable the government put in place a policy against tobacco use and enforce it. In other words, we want to assist the people who are already addicted to tobacco use to cease from smoking or tobacco use in any other form, and at the same time we want to help, particularly the youth, which has not yet quite started using tobacco to refrain from using tobacco.
All right, Mr. Richard Baguma, can I ask you to tell us exactly what you do? You are organized, the Uganda Health Communications Alliance.
The Uganda Health Communication Alliance was set up by us, your colleagues, Edmond, veteran journalists, some of us not anymore in the mainstream media, some of us still in the mainstream media. And our objective is to try and deepen as well as widen media coverage of health issues, as well as increase and advocate for health communication issues across the board. For instance, with Radio 1, we have carried out more than 2 training sessions relating to health issues. And in relation to the Tobacco Center, we are one of the 3 organizations. We are a consortium of 3, part of the consortium of 3 organizations: the Makerere University School of Public Health, the Uganda National Association for Community and Occupational Health, and us, the Health Communication Alliance, who bid competitively. This was an international competitive bid, and we bid and won to have the center hosted here in Uganda.
Is that because we have the best smokers of it? The worst problem?
We had the best proposals on how to tackle regionally the issue of smoking.
All right, let me come back to you, Dr. Machangu. We'll get back to you, of course, Mr. Baguma, for details on that. Dr. Machangu, can you give us some demographics of smokers? Dr. Mugyenyi just mentioned youth, the young people. Do you have other patterns that we can predict and say this child will one day be a smoker?
Well, and as far as patterning is concerned, we usually take by the rule of thumb that if a parent is a tobacco user, the chances that a child or the children will be tobacco users is very high. But also, there are situations which we encounter today where kids of parents who smoke don't smoke, and the kids of parents who don't smoke, smoke. The biggest influence which makes the young people start smoking is actually their bodies. In other words, the peer pressure from their own age groups, particularly in schools or in sports or in social events like parties. When the children get around the age of 13, 14, they want to emulate the adults they see that they use tobacco. In fact, some few years back, children, when they reach adolescence, they thought it was cool, if you may say so, playing adult, to use cigarettes, and in fact show off that they can smoke cigarettes because they are grown-ups. Now, the patterns which make people smoke are actually the peer pressure to start with, and then the model image, a parent, an uncle, a successful person, and this includes also such things like actors in cinemas,
yes,
musicians,
Hollywood,
and you remember the Marlboro Cowboy,
right,
which was a classic icon,
the eternal cowboy,
exactly, who apparently died out of lung cancer, of course. But this is one of those examples of how kids fall into this trap to start smoking.
All right, we'll go deeper into that. But first of all, Mr. Richard Baguma, can you talk to us about how your campaign has been shaping up?
We are just beginning. The center is going to be launched on Tuesday, the 1st of November, officially. But that's the official launch. We started a couple of months ago, more than a year ago, and we convinced the World Health Organization and the Bill and Melinda Gates Foundation that Uganda should host this because they are the ones behind the funding and technical support, as you can see, Dr. Robert here. That Uganda can take lead in supporting governments to either initiate or galvanize the efforts that are already underway in the direction of tobacco control. And things like policies and laws, where they exist, enforcement is oftentimes inadequate. Our ourselves, the media. We get creatively mobilized by the tobacco industry to promote their agenda. So we would like to come and share the statistics that we have. In Uganda, unfortunately, the statistics we have are only based on what the tobacco industry has been saying, so we cannot...
Oh, really? We don't have independent
We are unsure how we can trust that information, so we want to do our own studies.
Right.
We want to encourage all governments in the region, particularly the 5 countries that this center is serving, to do their own statistics, to do their own studies, because, you know, this tobacco question is not just smoke-based tobacco.
Right.
There are other non-smoke-based tobacco uses.
Right.
Chewing, for example.
Right. Okay, we'll talk about those a little bit in more detail. Let's come back to Dr. Prossy Mugyenyi on the line. Can you take us through the dangers of smoking? Is it such a bad thing, or is that so much, you know, too much of a storm in a teacup? Hello? Dr. Prossy Mugyenyi on the line. Do we still have you?
Yes, I'm there, but I pushed most of the discussion is the specific comment I can make it.
Okay, you can talk to us about the specific dangers of smoking. Is it such a bad thing, really?
The dangers of tobacco?
Yes, smoking.
Yes. You listeners will know that tobacco causes a wide range of health problems. Tobacco is a big contributor or a very significant risk factor for cancers like cancer of the lung. It also causes cancer of the mouth, of the throat. Tobacco is responsible for stroke. Tobacco is responsible for heart disease. Tobacco has been identified to be a risk factor in diabetes mellitus. Many people know diabetes. Tobacco increases the risk of getting tuberculosis, and tobacco has actually been associated with infertility among women. Tobacco has been associated with affecting newborns, like causing low birth weight where children are born very small. And actually for men, tobacco is responsible for increasing chances of getting impotence. So it's a very, it cuts across most of what we call non-communicable diseases.
That's serious. If you smoke too much, if you chew tobacco, you could end up being impotent.
You could end up impotent, you could end up you having a broken marriage, and those are health problems, the direct ones. In fact, when you look at the chart of the diseases that come from tobacco, you really get scared, because literally every organ of the body is literally affected by tobacco, and many people seem not to know. And actually research has found that people who smoke heavily or who smoke, they die 15 years younger on average,
really?
compared to people who do not smoke. So tobacco use reduces your life on earth by an average of 15 years.
And the people who smoke, are some of them educated, or do we have most of the people who don't know what to do that smoke? The people who use tobacco, is there a connection with literacy or lack of it?
A connection with?
The literacy. People who went to school, do they smoke as much as the people who never went to school?
I don't think that there is much difference as far as I know. Robert could help us on this, but you see, tobacco use is in different categories. There are people who use cigarettes, the packed cigarettes. Of course, the educated people are common on that. They use cigarettes, packed cigarettes. But people who are not educated, they use non-packed cigarettes. There is a lot of chewing of tobacco, especially in the rural areas. People use pipes. You know, these pipes which people use, put tobacco and smoke. So the different social sectors, they use different types of tobacco, but I think there is a widespread use of tobacco both among the educated and the educated and the uneducated.
So when the people go to school, they smoke. They know it's bad. They tell you they don't know how to smoke, and then they say, "Excuse me," and then light up and go ahead and smoke. No puffs in
Yeah, it's a question of behavior change. You know, many people know the dangers of tobacco.
Yes.
And they will go ahead and stop. As I said at the beginning, they find themselves caught up in the web of smoking at this stage. So what we need to do as programmers, as government, as NGOs, is to design programs that can help them to quit. To be assisted to quit smoking. Otherwise, a good number of them know the dangers, but some actually do not know the dangers, and they smoke in ignorance. They don't know that they are risking their life.
Well, we talk about the two, those who know what to do and still smoke, and those who don't know what to do and smoke out of ignorance. We're going for a break. Just stay tuned.
Is your internet provider turning your world upside down? Broadband Company offers fast and reliable internet solutions. And for the first 100 subscribers this month, we offer zero connection fees. Save up to 400,000. For more information on these offers, call toll-free 0800 222 111.
Broadband Company, more than you expect.
Maria!
Hey, Mom, what are you doing here?
I forgot to spread on the other slice, Maria. Take this.
Hey, Mrs. Machangu, what are you doing here?
You know, Blue Band helps my child grow. That's why I spread on every slice.
Every slice spread with Blue Band is an opportunity for your child to grow. So mums, spread on every slice. Daily Blue Band, daily growth.
Alive and free.
I wanna be alive and free. I wanna be alive and free.
I wanna be alive and free. I wanna be alive and free. You and me.
The spirit that binds us.
Strictly not for sale to persons under 18 years. Please drink responsibly.
Spectrum on Radio 1 FM 90 is brought to you by Stanbic Bank.
Welcome back on Spectrum tonight. What are the dangers of tobacco use and measures that can be taken to deal with the situation? Our guests tonight, Dr. Prossy Mugyenyi, manager at the Center for Tobacco Control in Africa, on the line, joining us tonight. Dr. Robert Machangu from the World Health Organization based in Kampala, and Mr. Richard Baguma, a veteran journalist now at the Uganda Health Communication Alliance. You two will be able to call in shortly and contribute to this discussion. Dr. Machangu, can you give us some statistics globally? Is it a bad thing elsewhere? Are we alone in it?
Well, if you mean figures in terms of how many people are
affected adversely, obviously, by tobacco.
Well, we talk about, first of all, the smokers.
Yes.
Smoking, because it's the most researched upon. The smokeless tobacco, unfortunately, we don't have too much information in terms of data figures, because not too much research has been done, especially in this part of the world, on how many people still use snuff, chew tobacco, or who snort tobacco, in other words.
Or what?
Who chew.
They chew it.
They chew.
Or they snuff it.
Or they sniff it.
They sniff it. They put it in their nostrils.
Yes.
Sniff.
Normally it's the chewing, sniffing, or they eat it in the mouth. Right. That is chewing. They chew the tobacco leaf.
Yes.
But you can make the snuff, and what they call in other countries a dip, and you put it inside your mouth.
Yes.
And you continue sucking it.
Right. Okay.
But also, of course, chewing the leaf of tobacco, which is also common in some parts of the world. And as far as smoking is concerned, we have quite some reliable data, and that shows that we have about 1.3 billion smokers.
1.3 billion people smoke cigarettes out of the population of 7 billion.
Sure.
That's a large number.
That is a very significant number. And this varies from the level of smoking, because that one also makes a lot of difference. Like how much smoking